Hello and welcome to At Risk for Liver Cancer, Prevent the Progression. My name is Lorraine Stiehl and I'm the Chief Executive Officer of the American Liver Foundation. We are grateful to Meijer Specialty Pharmacy for sponsoring this very exciting program for you today. We'll be covering important topics like dietary impact, importance of early diagnosis, preventative measures to reduce cancer risk, and life after a cancer diagnosis. So let's begin our program. We'll start with presentations, and then we will answer your questions. Feel free to insert any questions you have into the Q&A box in the chat, and we'll get to as many as we possibly can later in the program. So let's first welcome Katie Wenstrom, a pharmacist and manager of specialty pharmacy clinical programs at Meijer Specialty Pharmacy, and her colleague, Courtney Biehl, also a pharmacist and area business manager of Oncology at Meijer Specialty Pharmacy. Let's get started. And Katie, will you kick it off with our first topic, which is dietary impact?
Lorraine, I would love to. Welcome, everyone, and thank you so much for joining us today. We're very excited to be here. As Lorraine mentioned, I will be starting out talking about the dietary impact on liver disease. And first, before we dive right into dietary impacts on liver disease, I thought it would be appropriate to do a short overview of what the liver does, a quick review for everyone. The liver is one of the largest organs in the body, and it is a powerhouse of different activities that help to keep us healthy and functioning properly. One of the most important pieces that the liver does is filtering toxins from the blood. And any type of toxin that we ingest, whether it be alcohol, chemicals, bacteria even, is filtered through the blood and filtered out through the liver. And so the liver is very, very important to keeping us healthy from outside invaders. The liver also manages blood clotting. And it is really helpful in absorbing vitamin K. Vitamin K is a very important vitamin for blood clotting. It's part of the blood clotting process in our bodies, and without the liver, we would not be able to absorb it from the foods that we eat. The liver also creates bile, which is really important for digesting and absorbing fat into our bodies. And you might be thinking, well, I don't think I want to ingest or digest fat and absorb it into my body. But it actually is very, very important. There are some fats that are better than others, which I'll talk about here in just a little bit. But in general, we do need bile and we do need certain fats for our bodies to function appropriately. Another very important function of our liver is that it helps us store sugar for energy. Sugar is the source of energy for all functions of our body. We need it for our hearts to continue beating, for our brains to continue working, and we get most of our sugar through our diet. When we are heavy in our sugar diet, our liver will actually take the excess sugar out of the blood and store it as a product called glycogen. And then at other times, when we don't have enough sugar in our blood to run all of our body systems, the liver will take that stored glycogen, convert it back to sugar to keep our blood sugar levels steady. So it's a very important process for keeping our metabolism working the way that it should. Our liver also makes protein that's needed for blood plasma. Amino acids are the building blocks of proteins, and proteins are what our bodies use to make muscles and other organs. And the liver is very important to create those building block amino acids and have them available to our body to make new muscle, build more muscle, and keep our organs working properly. And then last and certainly not least, the liver is an incredible piece of our digestive system. We need it to be able to absorb and digest many different things that are part of our diet, from fats to certain vitamins. And it also helps us to remove things that we eat that we should not have absorbed into our body, like toxins or bacteria and other things like that. So looking at different pieces of nutrition in liver disease, there are a lot of different factors that we can talk about when it comes to nutrition and liver disease. One thing that you'll hear both Courtney and I mention quite a bit is NAFLD, or non-alcoholic fatty liver disease. And that is where fats in our body build up in our liver and start to cause liver damage and liver problems. NAFLD is a risk factor for going on to develop liver cancer. There are many risk factors, but NAFLD is a really large one. And so our big focus here, especially when we talk about prevention, is preventing NAFLD, preventing that fatty buildup in your liver. And two of the diseases or conditions that lead to NAFLD are here on the screen: obesity and diabetes. So looking at obesity, this is a very common risk factor for developing NAFLD. People who are obese have a higher concentration of fat in their bodies, and some of that fat is in the liver as well, which leads to NAFLD. When we talk about ways to prevent obesity, two of the biggest recommendations are increasing physical activity and promoting healthy eating. Now, when we talk about physical activity, it can be really daunting for some people to think about how to do this in their lifestyle. We're not talking about people going out and running a marathon the next day, or training for an Ironman. Really, that increase in physical activity, what our goal is 30 minutes of moderate activity most days of the week. And that moderate activity could look like playing soccer outside with your children. It could look like going for a walk around your neighborhood. It could look like some vigorous gardening where you're standing up and sitting down and kneeling and moving around your garden a lot. And it doesn't even have to be something you would technically consider exercise, as long as you're out and moving your body. That's what we talk about and really focus on when we talk about physical activity. And then when it comes to healthy eating, there are two diets or eating patterns that really have shown to be very effective when we talk about, reducing weight and maintaining a healthy weight. The first one here is the DASH diet. And it was originally created to help people who had high blood pressure. DASH actually stands for Dietary Approaches to Stop Hypertension. But as they promoted this way of eating for people with high blood pressure, they also noticed that it was very effective at helping to decrease weight and cholesterol and other metabolic factors in the body. So the approach to the DASH diet is a focus on vegetables, fruits, and whole grains, and low-fat dairy, and more lean cuts of meat like poultry, beans and nuts, and fish, and really looking to limit foods that are high in sodium and added sugar and saturated fats. So think about animal products, especially red meat is typically very high in saturated fat, as well as full fat dairy like cream and whole milk. Another, really popular and common and effective diet is the Mediterranean diet. And what the Mediterranean diet is a combination of really just your basics of healthy eating, along with the flavors and cooking methods that you typically find in traditional Mediterranean countries like Greece and Italy. So again, the focus is on vegetables, fruits, whole grains, a more plant-focused approach to eating, so more plants and less animal products, but also a focus on increasing amounts of olive oil and herbs and spices for seasoning, and limiting red meat, added sugar, and some moderate portions of dairy as well. So along with obesity as a major risk factor for developing NAFLD, diabetes is also another large risk factor. And in diabetes, your body is not able to regulate your blood sugar levels, resulting in very high levels of sugar in your blood. This is really problematic to our body. When we have high levels of sugar in our blood for long periods of time, it can lead to a lot of different organ damage. It can damage your eyes, your nerves, your kidneys, and your blood vessels. And we know that NAFLD and diabetes go together very closely. There was one study that found that about 70% of people who have type 2 diabetes will also go on to develop non-alcoholic fatty liver disease as well. So we know because of that, close correlation between the two, that if we manage diabetes and prevent diabetes in some people, we will also be managing and preventing NAFLD. The approach to managing diabetes from a nutrition and lifestyle standpoint is very similar to managing obesity, what we just talked about as well. So increase in physical activity, increase in healthy eating patterns, with the added focus here on reducing refined carbohydrates in your diet. Refined carbohydrates are things like white bread, white pasta, candy, sugar sweetened beverages, anything with simple sugars in them. And when we eat those foods that have those simple sugars in them, especially if a person has diabetes, it raises the blood sugar level considerably and quickly. And that makes it even harder for the body to regulate their blood sugar levels. And so, nutritionally, we really focus on avoiding some of the avoidable highly processed foods, think cakes, cupcakes, cookies, that type of thing, and then switching out more complex carbohydrates for some of your more refined carbohydrates. So eating whole wheat bread instead of white bread, or whole wheat pasta instead of white pasta. When you eat whole grains instead of refined grains, it does not raise your blood sugar as quickly or as significant, and it's much easier for your body to process and to keep the right amount of sugar in your bloodstream. So then going on to look at nutrition ways to prevent NAFLD, non-alcoholic fatty liver disease. We know that this is mostly caused by metabolic risk factors, so ways that your body metabolizes different foods and different things and different processes. So again, looking at metabolic risk factors like obesity, diabetes, high cholesterol, high blood pressure, managing all of those things will help you to also reduce your risk of NAFLD. So you notice here that we also have the recommendation to increase physical activity and work on healthy eating patterns, because again, that will help with all of those metabolic risk factors and decrease your risk of everything altogether. And then the last thing that we have on the slide here is hepatitis C. And I do want to mention that this is a separate category. So the other three, obesity, diabetes, and NAFLD, they all sort of play together in the same area. They can lead to one another, and decreasing risk of one will decrease risk of others. Hepatitis C is a viral infection. It's a little bit different. It's not metabolic related. And so there are different recommendations for decreasing risk here. However, even though it is a separate condition, a viral infection, we know that type 2 diabetes and obesity can play a role here as well. So people who have hepatitis C are at higher risk for developing type 2 diabetes, and hepatitis C can be made worse. People have worse outcomes, they have worse symptoms when they are obese or overweight. So because of that, the recommendation to increase physical activity and practice healthy eating patterns is still the same here for hepatitis C. The one additional recommendation, however, is to avoid excess iron. So we know that people who have excess iron in their bodies and have hepatitis C actually show greater progression of hepatitis C faster. It actually helps the virus to replicate faster when you have more iron in your body. So you don't have to restrict your iron, but you want to make sure that you're not getting too much for your body. And one very interesting fact that I learned recently was that people with hepatitis C should avoid cooking or eating meals that have been cooked in cast iron pans, because cast iron pans actually give a lot of that iron from the pan into the food. And so foods that are cooked in that type of cookware actually have higher iron than if you cooked the same thing in a non-cast iron pan. So watch out for that if you have hepatitis C. Now I have to give a plug for another presentation that some of my colleagues will be doing very soon. So if you are interested in learning more about nutrition-related education on liver disease, registered dietitians from Meijer Specialty Pharmacy will be giving a fully nutrition-focused presentation next month on October 26th, and I would highly recommend joining for that one as well. All right. Thank you, Katie. So, after discussing how our livers function and the important role nutrition plays in supporting a healthy liver, we want to touch upon how different risk factors or conditions such as obesity, type 2 diabetes, hepatitis B and C viral infections, and non alcoholic fatty liver disease, NAFLD, may further impact the liver. And we'll also explore how these disease states are interconnected, as well as key preventative measures, including the importance of early diagnosis to slow or prevent the progression to liver cancer. Next slide, please. Liver cancer diagnosis has been increasing over the past several years, and this slide has a lot of information going on. And so we're going to spend a little bit of time kind of really talking and exploring how everything is interconnected. Hepatocellular carcinoma, referred to as HCC, is the most common form of primary liver cancer and is the result of underlying liver disease in over 70% of cases. Liver disease may be caused by persistent infection with hepatitis B or hepatitis C or alcohol abuse as well. In recent years, NAFLD and its more progressive form, non-alcoholic steatohepatitis, or NASH, have become more prevalent as new focused risk factors for liver cancer. Katie had touched on metabolic risk factors such as obesity, cardiovascular disease such as high blood pressure or high cholesterol, and diabetes, and how they all may contribute to the progression of liver disease and liver cancer. So, when looking at various risk factors, it appears that the progression of liver disease to liver cancer moves linearly in one direction, where obesity can increase risk of fatty liver disease, which can develop into NASH, and so on. However, the progression of liver disease is variable and changing. And because of this interconnectivity between risk factors and disease states, well, we're going to first look at NAFLD and then work our way outward, defining what the risk factors are and how each may lead to liver cancer and why. So, NAFLD itself involves a spectrum from steatosis or a simple fat buildup to NASH, which may then progress to scarring of the liver with fibrosis, more severe or irreversible damage and scarring of cirrhosis, end stage liver disease, and then finally the development of liver cancer. There's strong evidence that NAFLD is linked with high blood pressure, type 2 diabetes, and obesity, and is becoming the most common cause of chronic liver disease worldwide. Again, liver disease can be quite variable, where people may have periods of time where their disease state may progress and symptoms may become worse, or regress and conditions may improve. And it's this fluctuation of disease state combined with a lack of identifying tests and biomarkers, which makes identifying patients with progressive NAFLD who are at risk of developing liver cancer very difficult. So moving outward, independent causes of liver disease again include obesity, type 2 diabetes, high cholesterol, or cardiovascular disease. And it's this combination of conditions, along with systemic inflammation in our bodies, that can individually increase the risk of liver disease and increase the risk of one another, which is where that interconnectivity comes into play. Obesity is associated with disturbances in how our bodies metabolize lipids or fats and glucose or sugars. And it's also associated with chronic inflammation and oxidative stress, which is associated with many types of cancer, along with a decrease in life expectancy. So, what may lead to obesity? High fat or sugar intake, poor diet, endocrine disorders such as diabetes, a lifestyle with little physical activity, all contribute to increasing body fat. Medications that we take may also have a side effect causing weight gain, such as corticosteroids, some contraceptives, hormones, or even some antidepressants. And there's also a genetic component that may play a role as well. Hereditary or rare diseases such as Wilson disease,
alpha-1 antitrypsin deficiency, and hemochromatosis all fall into this category. So in this pathway, how could we explain the relationship between obesity and liver cancer? In patients who have an increased fat accumulation, increased inflammation occurs, and inflammation is a response that is activated to protect our bodies against harmful stimuli. However, with repetitive chronic inflammation, that can actually cause damage to some of the processes in our body. And then there's also increased insulin resistance. All of this leads to what's called a pro-inflammatory signaling in the body, where these signals are secreted by fat tissue, and there's an increase in what is called reactive oxygen species, a decrease in antioxidants, and even a change in our gut microbiome. So as a result, this constant oxidative stress on our bodies can cause a downstream increase in DNA damage, a decrease in the ability for DNA to repair, and it's this accumulation of DNA damage that can cause further cellular mutations, which then that is what stimulates the development of cancer and cancer growth. So altered gene expression can further increase inflammation and disruption of cellular metabolism and promote metabolic disorders, which all in turn contribute to an environment that fosters cancer growth in the liver and additive effects on one another. So studies have found that DNA damage in people with obesity, that it appears to be reversible with weight loss and maintaining a healthy weight and with improved dietary habits. So all of this can positively impact and affect DNA and genome stability. Transitioning over to the relationship between diabetes and hepatocellular carcinoma or liver cancer, as Katie had mentioned, this connection has really strengthened over the past few decades, especially with the increasing prevalence of obesity and NAFLD. In a recent article in Clinical and Molecular Hepatology, they published that studies have revealed that patients who have diabetes have a 2 to 3-fold increased risk of developing hepatocellular carcinoma, and that advanced liver disease may promote the onset of diabetes. And liver cancer or hepatocellular carcinoma, conversely, diabetes is a risk factor for liver fibrosis progression, and HCC development may worsen the long-term prognosis of patients with liver cancer. Currently, there are no surveillance methods for hepatocellular carcinoma development in patients with diabetes that have been established, and liver diseases, including HCC, are often overlooked as complications of diabetes. Although some anti-diabetic medications are expected to be liver protective, further research on the optimal use of anti-diabetic medications are still ongoing. So diabetes is really an important risk factor in the development of liver cancer, and the presence of, separately now, viral hepatitis infection really compounds this development. And Katie had touched on, while hepatitis B and C are viral infections and have a separate pathway, they can be related or impacted with a diabetes condition. Hepatitis C viral infection, that is known to be associated with insulin resistance and can contribute to the progression of underlying fibrosis and, in the end, the development of liver cancer. The link between hepatitis B and metabolic conditions or insulin resistance, that really is still remaining inconclusive. In most cases, it is unlikely that a patient who has hepatitis C will develop liver cancer without also having cirrhosis or advanced liver scarring. Hepatitis B, however, may cause liver cancer through a multiple of mechanisms that impact cellular health, including inflammation that can cause genetic damage, even when patients do not have cirrhosis present. So patients who have liver cancer and hepatitis B may not necessarily have cirrhosis. And just for some kind of statistics behind prevalence, there was an independent peer-reviewed journal of gastroenterology and hepatology, and they found that 50 to 60% of patients with liver cancer in the United States are infected with hepatitis C and 10 to 15% with hepatitis B. And what's interesting is that with more recent increased education and the availability of hepatitis B immunizations, there is a trend in decreasing prevalence of hepatitis B. There's also an increased cure rate of hepatitis C with the availability of direct-acting antiviral agents. And this is shown to halt the progression of liver fibrosis, even reversing liver fibrosis in some patients, and in turn, decreasing the risk of liver cancer. Hepatitis C, excuse me, direct-acting antiviral agents also have had improved adherence over the years due to the increased availability of oral therapies. And finally, before we move on from our slide here, I do want to mention hepatic hyperplasia, which is an overgrowth of cells in the liver. And although this increased cell production is considered benign and non-cancerous, some instances of hyperplasia may eventually develop atypical cells that could, in rare situations, progress to liver cancer. So something to keep in mind there. Next slide, please. So it's often hard to detect liver cancer early on because the signs and symptoms often do not appear until much later. This is an inclusive list, but please remember our bodies are individually different and only a small number of symptoms may be experienced, or there may be no outward signs that indicate liver cancer. Symptoms may be mistaken for progression of liver disease activity or even mistaken as abdominal discomfort. And so liver cancer or hepatocellular carcinoma, it may present in different ways. And some of the most common symptoms of liver cancer include a loss of appetite or feeling full after a small meal, weight loss, fever, nausea or vomiting, pain in the abdomen or belly or right shoulder blade area. So think about where our livers are positioned in our bodies. An enlarged liver, swelling or fluid buildup in the abdomen, an enlarged spleen, yellowing of the skin and eyes, which may indicate the presence of jaundice, itching, abnormal bruising or bleeding, enlarged veins visible under the skin of the abdomen, and weakness. Next slide, please. As a background, liver cancer may be classified as a primary cancer, which means the cancer has originated or is first formed in the liver. When a cancer is classified as secondary, that means the cancer has started in a different area of the body and has then spread to the liver. A study in 2021 in the Journal of Hepatocellular Carcinoma stated that primary liver cancer is the 6th most common type or incident of cancer and the 4th leading cause of cancer-related mortality worldwide. Hepatocellular carcinoma, it accounts for 90% of primary liver cancers and usually develops in the background of liver cirrhosis. Historically, the most common underlying causes of cirrhosis associated with HCC have been hepatitis B or hepatitis C viral infections. However, again, mentioning in recent decades, with the implementation of hepatitis education and treatment therapies combined with the increased prevalence of lifestyle-related diseases such as obesity, high blood pressure, high cholesterol, and type 2 diabetes has really transitioned NAFLD to becoming one of the more leading causes of liver cirrhosis and liver cancer in many Western countries. Starting off with with our screening options that are available today, initially, a medical history and physical exam will be performed, and the provider will review any changes in health, perform an abdominal exam, and check the skin and whites of eyes for any yellowing, which again indicates that potential presence of jaundice. Further imaging tests may be ordered by providers such as x-rays or CT, which is computerized tomography scans, magnetic resonance imaging, and that shows a detailed image of soft tissues in the body, um, or an angiogram. And an angiogram looks at our blood vessels and the blood flow to the liver to see that blood supply. An ultrasound, however, is typically the first test used for the liver, and it uses sound waves to see if there is any tumor growth. If a tumor is found on the liver, a biopsy may be performed. And a biopsy is a removal of sample tissue that is then sent to a lab and tested to see if it's cancerous. A biopsy is usually performed by a surgical procedure. And there are also some laboratory tests that are available to determine the overall health and function of the liver. Alpha-fetoprotein levels are monitored, and although not a perfect indicator of a tumor, the logic is that increased alpha-fetoprotein levels can indicate the presence of cancerous conditions. A complete blood cell count, liver function tests, blood clotting, and kidney function tests may also be ordered to obtain a more complete picture of what is happening in the liver and in our bodies. So at this time, people who are at low to average risk for liver cancer do not have widely recommended testing or screening available. However, for people with long-standing or a history of cirrhosis, hereditary conditions such as hemochromatosis, chronic hepatitis B infection without cirrhosis, or a family history of liver cancer, having an ultrasound every 6 months along with alpha-fetoprotein blood tests have shown to improve prevention and catching hepatocellular carcinoma earlier on.
Thank you, Courtney. Now, combined with early screening and knowing signs and symptoms, it's also important to consider different measures that you can do to prevent or reduce your cancer risk overall. There are a number of different conditions that both Courtney and I have talked about before that can lead to liver cancer. And so we'll break each of the major ones down and talk a little bit about prevention measures for each of these. First here we have is fatty liver disease, or NAFLD. Again, as both of us have mentioned, it's one of the main risk factors for developing liver cancer and is really metabolic in nature. And so you'll notice that many of the recommendations here have to do with diet and exercise and management of all of those metabolic risk factors. So first method to reduce your risk of developing fatty liver disease is to limit your fat intake. Again, fatty liver disease is the buildup of excess fat into your liver. So if you eat less or intake less fat, there is less to build up in your liver. Now, one caveat I do want to add here that I did mention before too, is that your body does need certain amounts and certain types of fats to work properly. So you can't cut out all fats from your diet and expect everything to feel okay and to live healthily. And what we really want to think about here are the types of fats that you are ingesting. There are some fats, like unsaturated fats, that are beneficial for you and do beneficial things for your body. And then there are the less beneficial fats, like saturated fats and trans fats, that do harmful things to your body. And so what we're looking for reduction here is in those saturated and trans fats. Saturated fats are usually found in fatty cuts of meat, especially red meat, and whole milk dairy products. And trans fats are typically found in your processed foods. So things that are found, on the inside aisles of the grocery store, processed cakes, cookies, breads, things in those categories. While as unsaturated fats are typically found in your lower fat meat products such as poultry, especially fish, are very high usually in unsaturated fats. And so really looking to adjust your diet to promote more unsaturated healthy fats and less of the detrimental saturated and trans fats. Another big prevention piece for fatty liver disease is weight loss or maintenance of a healthy weight. I do want to mention if you are already at a healthy weight, we want to maintain that weight. You don't need to lose additional weight. So really losing weight if you are overweight or obese and then maintaining that healthy weight is a very important piece of the prevention puzzle here. Another piece is to limit your intake of simple sugars. And those are things like sweetened drinks. So think about pop and soda and juices, certain baked goods, desserts, candies, all of those things that have simple sugars in them. We talked about problems with eating simple sugars when we talked about diabetes earlier, where they raise your blood sugar significantly and quickly and make it a lot harder for your body to manage blood sugar levels. But we also know that diets high in sugar also promote more fat to enter into the liver as well.
So next up, we have hepatitis B and hepatitis C. So both, what's interesting with hepatitis B is that both are caused by a virus. We want to prevent the exposure of hepatitis B, where hepatitis can has immunizations available to treat, but once immunized or once hepatitis is contracted, there are interferon medications that can be used to treat that medication, but there's no cure at this time for hepatitis B. Conversely, hepatitis C, there is some testing available for that, but there's no immunizations available. And there are curative medications that are available for hepatitis C. So different mechanisms, which Katie, when she can go back on, to prevent the exposure, to get tested, and then also to get treated if diagnosed with hepatitis B and hepatitis C. Next slide, please. So hepatitis B is spread through blood and other bodily fluids. It can be contracted at birth with an infant that is born to an infected person. It can be contracted sex with a partner who has hepatitis B, sharing contaminated needles or syringes or drug preparation equipment, or it can be spread through direct contact with blood or open sores of a person who has hepatitis B. And exposure to blood from a person who has hepatitis B through needle sticks or other sharp instruments. Hepatitis C is spread through the blood, and typically, if you had received a blood transfusion or organ transplant before 1992, there's an increased risk for hepatitis C simply because with blood transfusion and blood transplant, organ transplants prior to 1992, we simply just didn't have correct screening process for bloodborne pathogens in transfusion and transplant situations. So prior to that, that is an increased risk for hepatitis C. If a patient has a history of injecting or inhaling drugs, clotting factor concentrates before 1987. If patients or people have been born between 1945 and 1965, there's that time period, there's an increased risk of hepatitis C and a strong encouragement to be tested for that. If someone is on long-term dialysis, if again, an infant born to an infected person, or people who have HIV are at increased risk of developing hepatitis C. Next slide, please. So there are blood tests available for both hepatitis B and hepatitis C. And those lab tests are available through laboratories, local health departments, and some pharmacies to receive that treatment or that testing. Next slide. So with hepatitis B, again, there is a vaccine for prevention and antiviral or interferon medications for treatment. However, there is not a cure and long-term treatment is required. For hepatitis C, there's no vaccine currently available, and there are oral antiviral medications currently available for treatment. There is a cure rate, and it's a short-term treatment taking place only 1 to 3 months. Next slide.
Apologies, I am back and can take over for Courtney again. So to round out risk reduction measures, we really focused on many of the large risk factors, but we'd be remiss if we didn't talk about a few of the less common but still very impactful risk factors for liver cancer as well. So we've talked about a couple of these already, which is really maintaining a healthy weight and limiting both alcohol and tobacco in terms of things that can be additionally harmful to the liver. Another really important piece is to avoid cancer-causing chemicals. Now, there are millions of different types of chemicals throughout the world, but the ones that we know of that are likely to cause liver cancer are found in waste disposal, metalworking, and manufacturing industries. So if you do happen to work in those types of industries, really the important piece here is to make sure that you're following all of the safety protocols at your place of work and making sure that all of those are being taken care of there. And then additionally, make sure that if you do have a disease that does lead to an increased risk of liver cancer, such as hemochromatosis, which is an overload of iron in your body, or Wilson's disease, which is where your body cannot metabolize copper like it should, or hepatitis B or C that we've already talked about here, then it's important to treat those diseases to reduce your risk overall.
Okay, so after reviewing how liver cancer may develop in our bodies, what can put us at risk, and how we can take action to keep ourselves healthy, we may still receive a cancer diagnosis. And when someone is diagnosed with liver cancer, providers will figure out if the cancer has spread and how far. HCC, or hepatocellular carcinoma, which we have discussed previously, and bile duct cancer, also called cholangiocarcinoma, are the main types of primary liver cancer in adults. And once a cancer diagnosis occurs, really the important first step is to become informed. So receiving a cancer diagnosis, it may be quite overwhelming. And by taking steps to prepare and become educated and informed is important in understanding the treatment and care plan developed between providers and patients. American Liver Foundation, Meijer Specialty Pharmacy, and the American Cancer Society have wonderful support resources, and the best place to begin is by asking questions. So we've pulled some questions that both the American Liver Foundation and the American Cancer Society have prepared on their websites to think about when speaking with providers, and they're broken down into questions to ask when someone is recently diagnosed, when deciding on the best treatment options, and questions to ask during and after treatment. So some of those are listed there. Next slide, please. So liver cancer becomes more complicated by the time a diagnosis may occur, and liver function may already be reduced, or the liver may have increased damage from the presence of fibrosis or cirrhosis that can impact the type of treatment plan determined between patients and providers. So, for a liver cancer treatment, providers look at the overall health of the patient and the health or function of the liver, and then also determine the staging of cancer. Liver cancer is staged 1 through 4, with stage 4 meaning that the cancer has spread furthest throughout the body. Cancer staging occurs through a combination of screening results, and treatment plans may involve a combination of the treatment options listed above. Um, treatment plans are unique and again decided upon between patient and their oncology team. And if the cancer is not spread and part of the liver is healthy or has function, treatment options may include a liver transplant or replacement of the liver, or liver resection, which is a surgical removal or part of the liver that contains a tumor. However, surgical removal or liver transplant, it's really only an option for a small percentage of patients due to the health of the rest of the liver. And so since the majority of hepatocellular carcinoma is not detected until later in its progression, most function of the liver is quite reduced by the time of diagnosis. Next slide. So liver cancer treatment goes beyond surgery and medications, and it's important to remember to focus on what we can control, remembering to take care of your whole self through movement, stress reduction, good sleep habits, proper nutrition, and mental health support. As stated earlier, how much of the liver that remains healthy and functional impacts effective cancer medications and therapies, and keeping track of side effects and how you feel can help you incorporate manageable movement in your daily routine. And it's also important to rest when you need to rest and incorporate stretching or light movement when you feel able. So keeping track of those side effects and how you feel is important to keep open communication with your providers, as well as understand what foods or activities make you feel better. So caring for your whole self through mindful meditation, becoming involved in support groups, engaging in self-care to reduce stress, and adjusting a healthy balance of sleep, rest, and activity may reduce those causes of inflammation and help maximize a cancer treatment plan. And finally, a cancer diagnosis also affects our caregivers, and holistic care for people who support our cancer patients is equally important. The considerations listed here, such as finding a support network, becoming well informed, and taking mini breaks, practicing self-care, and seeking outside services. Those resources through the American Liver Foundation, Meijer Specialty Pharmacy, and more, along with accepting help. All of these flow continuously for those who are facing cancer and for those fighting alongside of them. I think we needed to move on to some questions.
We do. So thank you so much, Courtney and Katie. My gosh, I learned a lot, and I'm sure our audience did as well. And tell me about those tech challenges. That's our world, isn't it? Those questions. So Courtney, I'm going to start off. My husband has acute myeloid leukemia that then developed liver cancer. Is there a connection between the two?
Lorraine, it's unlikely. However, the exact relationship is unknown. A connection hasn't really been reported. There was a study where one patient was thought to have a liver cancer diagnosis, but upon further testing, the core biopsy of the liver tumor was shown to actually be acute monocytic monoblastic leukemia, which had spread to the liver and masqueraded as liver cancer. But currently, the opposite, where acute myeloid leukemia developing into liver cancer, there isn't an exact relationship known at this time.
Thank you for that. So Katie, here's a question. I was exposed to toxic waste in the military. I see many others who are developing liver diseases like cancer. What can I do to avoid getting that diagnosis?
Ooh, that's a tough and a very good question. Really my biggest recommendation here is, we can't reverse the exposure that already happened, but what we should be focusing on going forward is reducing your risk as much as possible. So Courtney talked a lot about oxidative stress and things that can happen in the body that can lead to DNA damage and things that can also then lead to cancer development. And so really working to reduce that type of oxidative stress in the body is going to be the best bet here. And good for us is that doing those things is actually very easy and has a lot to do with the nutritional recommendations that I shared earlier on in the presentation. We know that fruits and veggies, anything that is, brightly colored produce is going to help and provide a lot of antioxidants that help here. Additionally, limiting processed foods, limiting those high trans fats foods will really help to do that, along with exercise. And then if you do smoke, quitting smoking, because smoking, tobacco, nicotine, everything in tobacco products is a promoter of oxidative stress. So taking that away will help to reduce that overall.
Terrific. One more question for you, Katie. This question says, I have a family history of liver cancer. Should I be getting CT scans or MRIs proactively to be sure I don't have it?
Also a wonderful question. The heritability and how you develop liver cancer is really complex. Just because you have a family history doesn't necessarily mean that you're going to develop it. You are at slightly higher risk, but there's a lot of other lifestyle and environmental causes that really intermix here to result in your overall risk. So what I would say is, CT scans and MRIs, it's not in the literature recommended. I think Courtney mentioned, potentially an ultrasound every 6 months or so to take a look. But really what you should be doing is working to reduce those risk factors and also working with your doctor if, your primary care doctor, or if you see a hepatologist, someone who specializes in the liver, they'll take a look at your overall medical history, and you can work together to make that decision on what type of monitoring is right for you.
Okay, Courtney, I'll take it back to you. Here's the question. I've been taking magnesium and D3 supplements for a long time. So that's vitamin D, right? I was just diagnosed with liver cancer. Did these lead to the cancer? Should I stop taking them?
So higher magnesium intake has been linked to a lower risk of developing liver cancer, and it can also help preserve liver function. The precise ideal magnesium level in the blood to reduce risk hasn't been established. However, the recommended daily allowance for magnesium is between 310 to 320 milligrams a day for women and 400 to 420 milligrams a day for men. Vitamin D3 it's okay too. It has also been associated with lowering your risk of liver cancer. The recommended daily allowance for men and women over age 19 is 600 international units daily. And then for adults over 70, there's a recommendation of 800 international units daily. So magnesium is found in your green leafies, your veggies such as spinach and kale, and also salmon and bananas and nuts. And vitamin D intake can be increased by eating foods such as fish and milk and eggs, or by getting a reasonable exposure of sunlight each day, but wear your sunscreen.
Okay, another question about clinical research, and I'm so passionate about clinical research. What types of clinical trials are there going on right now in liver cancer? Courtney?
Lorraine, there is a phenomenal search tool on liverfoundation.org, and it really highlights and shows, what qualifications there are, what studies are out there, and it really gives a nice overview of what a clinical trial is and if it makes sense for you, and really connects people with clinical trials. So
Thank you.
liverfoundation.org.
Yes, thank you for the plug. And we are really, really anxious for all of you to consider getting involved in clinical research. It's just so important for the greater good. Okay, Katie, what type of alternative treatments or an integrative health option should we seek out? This individual wants to fight, outside the box, so to speak, and do everything they can.
Sure. There are a lot of unique products and vitamins and supplements that are being studied right now to help reduce the risk of liver cancer. Unfortunately, there is no good current data out there on the effectiveness of one product versus another. So I don't have a good answer for this right now. I think time will tell. Like I said, there's a lot of different products being studied right now. But as of today, we don't have a lot of good objective data to show. So my best recommendation here, and that's not to say that you shouldn't try things, but always in combination with your doctor and your pharmacist as well. The one thing that, I'm passionate about as a pharmacist is even things that are sold over the counter can have really significant interactions with medications, prescription medications that you take or other diseases that you have. So if you do decide to, try an alternative route, a supplement or something like that, just always make sure you're checking both with your treating provider and your pharmacist as well to make sure that it is safe specifically for you.
Great. And I'm so excited. We've got some questions from our Facebook group. And if you haven't been involved in our liver cancer Facebook group, we hope you'll sign up. It's a wealth of information. But Katie, this is a question. The doctor says I won't die from PBC, primary biliary cholangitis, but that you could get other things such as liver cancer. What's the probability?
Sure. So the doctor is entirely right. PBC, while it is uncomfortable and can really impact your life, it is not overall a fatal disease. However, because it does affect your liver, you are going to increase your risk for other liver conditions like liver cancer. From the literature that I could find, the numbers and the probability vary, but they found that most people with PBC have between a 4 and 10% additional risk of developing liver cancer. So it's not a huge risk, but it is a higher risk than someone who does not have PBC.
Terrific. And I see we are at the top of the hour. We do not have time for more questions, but we see so many of you have questions and we'll be following up and getting you that information. But let me just do a quick close here. It's sad that we've reached the end of our time together, but 2 quick announcements. If you or a loved one has liver cancer, we invite you to join on October 21st for our virtual liver cancer conference. And on October 26th, guess what? We have another opportunity to hear from our amazing partner, Meijer. We have a great webinar on nutrition with a live cooking demonstration called Feeding Your Liver and Fueling Your Life. So registration for both is available at liverfoundation.org. And Courtney, Katie, thank you so much for this great presentation, and how exciting that we have a coming soon so we can hopefully answer these other questions. So if you have additional questions about Meijer Specialty Pharmacy, please visit their website, MeijerSpecialtyPharmacy.com, pretty easy. And if you have more questions about liver disease, the American Liver Foundation can help you. Call our helpline, 1-800-GO-LIVER. Repeat that, 1-800-GO-LIVER. Or chat with us at liverfoundation.org. We have an amazing helpline that can support you. We have trained specialists to help you Monday through Friday. lots of free resources on our website. So again, thank you so much to our Meijer partners, and thanks to all of you for joining us, and more to come. Stay tuned for October. Thank you.